Welcome to Life After the Stroke, Seizure Nightmare. Part 2. Cutie was in a post-ictal state for 4 days. Most of the time, she was not moving. Her head would shift occasionally, misaligning the endotracheal tube. Her arm was swollen because blood technicians could not extract her blood correctly, so I denied blood work until her last day. She was in the intensive care unit for 7 days. On day 3, the nurse asked me, did I want the hospital to fully resuscitate Cutie if her heart or breathing stops? I said yes. During this time, she was given intravenously levetiracetam, also known as Keppra. The 4th day, nurses woke her up. I was there at the foot of the bed so she would see a familiar face. I could not remember if the endotracheal tube was taken off first before the nurses were waking her up or after. Ultimately, the tube was out. She did get an infection. She received IV antibiotics in the ICU for 5 days. She was in ICU for 7 days. During that time, she was still fed through the feeding tube. She had awareness. Her neuropathy was very painful, so the nurses gave her gabapentin. The gabapentin caused her grate of irritability. The feeding tube was taken away. She had a good appetite during the last few days. On the last day, the hospital did not want to discharge her to my care. The hospital wanted to send her right back to that rehabilitation nursing facility I mentioned in the previous videos. The hospital claimed that she had too many falls at home, which was true. I said Cutie had fallen just as many times in that rehabilitation nursing facility. Eventually, Cutie was discharged into my care. We were both sent home in the ambulance. She had 2 additional medications, gabapentin and Keppra, but both medications caused mood swings, anger, and depression. Since Cutie took this medication less than a week, I discontinued those medications under her doctor's recommendation. Cutie started taking alpha-lipoic acid, increased hydration, and her blood sugar were being controlled with the help of a visiting nurse. A year had passed. She had 2 minor slips, which I was there, preventing the slips into falls. She went to all her doctors. She has had a small aneurysm, so she had to go to a neurologist every 6 months. She had to go to the dentist for a root canal. She did home physical and speech therapy 2 to 4 days weekly. Cutie does have permanent disability in her speech, some long and short time memories, and maybe her right side of her body. This concludes Life After the Stroke, Seizure Nightmare Part 2. Here's my final thought. It was a good thing that Cutie had a seizure getting up because I heard the fall. If she had the seizure in bed, I would not have heard her. What would I have awoken up to? Comment the possibilities. Come back to see what happened in year 2. The stroke changed us. Hit the like button, follow, and subscribe to Life After the Stroke.